older or have a disability that affects their decision-making, some people are unable to make their own decisions about their care. Some people are no longer able to look after their own finances either. NCAT's Guardianship division handles those cases. It decides on applications for appointing guardians and financial managers for people living with a decision-making disability. Almost half of the applications in the Guardianship division are about people with dementia, and more than 60% concern people over the age of 65. In the following scenario, Steffi wants to apply for guardianship of her sister Lana, who has dementia. She also wants to be appointed as her sister's financial manager to allow her to look after Lena's financial and legal affairs. Lana is a 68-year-old woman who lives alone in a unit. Lana has a sister, Steffi, who has become more and more concerned about Lena's well-being and worries that she can no longer look after herself physically or mentally, and that she's not able to take care of money matters anymore. Steffi has also tried in the past to get Lena's permission to take over her legal and financial decisions, but Lana has said no. She says she's done it for 50 years on her own and that she is okay to keep doing it herself. Steffi did not agree, but there was only so much she could do while her sister seemed to be getting by. For a while, Steffi has thought that Lana has dementia, but because Lana keeps refusing to be checked by a doctor, no diagnosis of dementia has been made. Steffi knew Lana needed full-time care, but Steffi could not do anything without legal permission to make decisions for her sister. A few weeks ago, Lana had a fall in her home and ended up in hospital. The doctor said Lana was not looking after herself and she wasn't eating properly. Lana spent some time in hospital, then moved to respite to recover. The fall was a turning point for Steffi. She needed to get legal permission to take over her sister's affairs. As a first step, Steffi contacted the tribunal about her options. NCAT explained that Steffi needed to apply for guardianship of her sister. NCAT said that if her application was successful and she was appointed as Lena's guardian, Steffi would have the right to make lifestyle and personal decisions on Lena's behalf. Lifestyle or personal decisions include decisions about Lena's medical or dental treatment, where she lives and what services she needs. The representative from the tribunal explained that to make a guardianship order, the tribunal must be sure that Lana has a decision-making disability, that the disability means she cannot look after herself properly, and there is a need for Lana to have a guardian appointed. The tribunal representative also explained that to make a financial management order, the tribunal must be sure that Lana is not capable of managing her own money. There is a need for someone else to manage her money, and it is in Lana's best interests that an order is made. As part of the application process for guardianship and financial management of Lana's affairs, Steffi had to make a formal application to the tribunal. This meant that she had to fill out an application form and provide medical reports about Lena's physical and mental health and about Lena's ability to make decisions. When the tribunal received the application, they had to first assess the risks to Lana, asking what could happen to Lana if a guardian was not appointed for her. Is Lana in any immediate danger? The hearing was held at an NCAT hearing location close to the facility where Lana was staying, so she could come to the hearing. At the hearing, Steffi brought along her husband and her sister Lana. Steffi told the 3 tribunal members that Lana was diagnosed with depression in her 50s, and since that time, Lana hardly ever let Steffi visit her and rarely talked to her when she tried to telephone. Steffi said that about 12 months ago, Lana started to have trouble remembering to eat or to take her medication. Steffi had organised Meals on Wheels and a care worker to visit Lana at her home, but Lana had not let them into her unit. Walter, a social worker, and Isaiah, a doctor specialising in working with older people who have mental health issues, both told the hearing that in their professional opinions, Lana has dementia. Sonia, a community mental health caseworker, said that she'd been working with Lana for the past 5 years and had noticed that Lana could no longer look after herself and her home. Sonia said that she noticed this the most in the past year and that Lana needed to be reminded to take her medication, make meals and to have showers. Sonia said that Lana now refused to see her and would not see her local doctor either. The tribunal asked Lana whether she thought she needed someone to help her make decisions about where she should live and other parts of her life. Lana told the tribunal she wanted to go home and that she didn't need any help. Lana was unable to say what she would do once she got home. When the tribunal asked if Lana would like her sister to help her, Lana said definitely not. Steffi said that Lana would not accept help from any family member. Regarding Steffi's application for financial management of Lana's money, Lana clearly told the tribunal that she did not want a financial manager and that she would be fine to manage her money on her own. Lana told the tribunal about her savings account and budget. She also said she wanted to buy a new unit closer to the beach. However, when the member asked for more information about her plans, Lana was unable to explain how she would go about finding a new unit, how she would know she was getting value for money, or what was involved in selling her existing home. Lana was also unable to tell the tribunal what kind of people she should speak to about these plans and didn't seem to understand that it would be hard to sell her unit and buy another one by herself because of her health problems. In making its decision about the guardianship order, the tribunal had to consider the risk to Lana against her right to make her own decisions. Before the tribunal can appoint a private guardian, it has to be satisfied that the guardian and the person will be able to get along with each other and that there is no conflict of interest. The guardian must be willing and able to take on the role. The tribunal can appoint the public guardian to make decisions for a person with a disability if there are no family or friends available, or if it wouldn't be right to appoint a private guardian for other reasons. Because of her disabilities, the tribunal decided that Lana had difficulty with making decisions and managing on her own. The tribunal decided that there was a need for a guardian to be appointed because Lana would not let Steffi help her, and decisions needed to be made for Lana that would probably be against her wishes but necessary to keep her safe and as healthy as possible. The tribunal took into consideration that Steffi did not want to be Lana's guardian because she was worried about the effect it may have on her relationship with her sister, especially if she had to make decisions that Lana did not agree with. Because there was no other suitable person available, the tribunal appointed the public guardian to make decisions about Lana's accommodation and her medical, dental and other healthcare needs for 12 months. The tribunal let Lana know that she could appeal the decision. Lana said that she would think about this, but that she was happy that someone other than her sister would be looking out for her well-being. Then it was time for the tribunal to decide about Lana's financial affairs. To make the right decision, the tribunal needed to be satisfied that Lana was not able to look after her own money matters, that there were things that needed to be done about her money and property, and that it would be better for Lana if someone else did these things. The tribunal also had to decide whether Steffi would be the best person for the task. If Steffi was appointed, then she would be overseen by the New South Wales trustee and guardian. The tribunal also had the option to appoint the New South Wales trustee and guardian to look after Lana's money and property for her. The tribunal decided that Lana's health condition meant she was incapable of managing her financial affairs because she was not able to plan for the future or make decisions about her pension, and these things needed to be taken care of. The tribunal also decided that it was in Lana's best interests for a financial management order to be made to make sure her money was looked after. At the hearing, Lana told the tribunal that she would prefer to have her sister manage her money rather than the New South Wales trustee and guardian. So the tribunal made a financial management order for Lana, appointing Steffi to manage her sister's affairs. Most people with a decision-making disability manage with help from family, friends and service providers. They do not need a guardian or financial manager. But if you believe that a family member or someone else you care for needs someone to make lifestyle and personal decisions because they have a decision-making disability or need someone to take over management of their financial matters, you can go online to www.ncat.nsw.gov.au to find more information.